Hi, welcome to the North Suburban YMCA, another YES program, YMCA Education Series program. Today I'm going to just go right into our speaker. Today we have Sam Breden from Always Best Care in North Shore. Here you go.
Thank you. Again, thank you so much for taking the time to join us today. My name is Sam Breden, and I'm with Always Best Care North Shore. I'm joined here today with Charmaine Conaghan, who is our owner. And we are going to talk to you guys about aging in place versus moving to a senior community, some of the things to think about if you're considering either of those options. Before we get into that, just a little bit about us at Always Best Care. Always Best Care is a franchise, so there are 200 plus offices around the country. Our office is in Glenview. We opened in 2011, and we are the longest standing office in the state of Illinois. There are three Always Best Care offices in Illinois right now. What makes Always Best Care a little bit unique and what really leads to this presentation is that we do two things. We provide the caregiving services in somebody's home, wherever home might be. But we also do recognize that there are times where staying at home may not be the safest or the more ideal option. And so if that's the case, we can help people choose a senior community that is the best fit for them. This slide here just shows you a little bit the areas that we serve. So north side of Chicago, the North Shore, and a little bit into Southern Lake County. And then what makes us unique is our very stringent caregiver and hiring process. We do a very in-depth assessment and spend a lot of time and energy finding the right caregiver for somebody. And we do take a lot of pride in collaborating with a lot of other healthcare providers and organizations in the area. And our proactive and open communication. So again, that's just a little bit about us. And we're going to jump right into our presentation, Aging in Place versus Moving to a Senior Community. And we're going to start with Charmaine.
Hello, I'm Charmaine Conaghan, and thank you very much for that great intro, Sam, and description of our agency. I'm very proud of the team we have here. So yeah, I'm going to talk about home care. Sam, if you could switch slides. If you decide to stay at home and you choose to pursue getting a caregiver in place to help you, I just want to describe to you what home care is. But first I want to start with what is home care versus what is it not? Home care, that phrase is often confused with home health care. A home health care agency or a home health agency will provide a nurse, physical therapist, occupational therapist, and sometimes even a speech therapist to people temporarily after they've had a hospital or a stay in rehab. Medicare provides this service, and it is usually temporary in nature. So we are not that. We are not home. We're not home health. See, I'm getting confused. We're not home health. We are home care. So home care, if you could go to the next slide, Sam. Home care is private pay rather than Medicare, and it can be paid for privately. It can also be paid by Medicaid waiver in Illinois. That's the CCP or Community Care Program. And also VA services can take on the caregiving for you as well. Home care can be provided on a temporary basis if that's all you need, if you're just recovering from something, or it can be a regular part of your life for as long as you need it. Home care services can be provided by a licensed agency like ours, or some people do engage a caregiver on a direct basis, or they can use a placement agency, which helps people find a direct hire caregiver. But we are a licensed agency. Home care services can be provided wherever you need them in your home. If you want to stay in your home, if you happen to be in rehab and you need one-on-one attention, we can help you there. We can help people in an assisted living community or an independent living community, wherever it is that you are, whether it's permanently or temporarily. If you need help, we can help you there, wherever it is. But for the purposes of our conversation today, I'm going to describe our services kind of in the context of being in your home. Okay. So the things that we can provide light housekeeping. That can include sweeping, vacuuming, doing dishes, taking out trash, cleaning the counters, making the bed, changing bed linens, and doing laundry. We can help with personal care. We call that activities of daily living. This is as much or as little assistance as you need. We don't want to take over anything for you. If you are, say you need some help in the shower, if you are perfectly capable of showering on your own, but maybe you need help in and out of the shower, or you need a little help drying off, our process, or anyone who is helping you, their process should understand how much help you need versus how little help you need. Okay. So those activities of daily living can include bathing and showering, dressing, toileting, any incontinence care, hygiene, standing up, we call this transferring, ambulating, that's walking, eating, and medication reminders. We can also help with dementia care. Dementia care consists of when a caregiver can keep someone who has memory loss safe. Whether they need constant monitoring, they're more advanced stage, or if they just need some companionship and guidance, and every stage in between. We can help people through that whole journey if they need us. We can also run errands for people, grocery shop. We can drive them to medical appointments. I may have run out of room. Sam, is the next slide? Did you?
There we go.
Okay. Okay. Just a few more things. We can help you with all of the tasks I described, or just a few of the tasks I described. But that's basically a synopsis of what home care is and what we can do. How do you know? How will you know whether you should start? When do I make this? This decision, because it can be a kind of a big deal for people to decide whether they should bring a caregiver into their lives. I will say that it's always better to be proactive than reactive. We get a lot of calls, and we're happy to help people who are in a crisis. That's people being reactive to a crisis. If something happens and they need help and they need it now, we are happy to help them and step in. But those folks who kind of see what's going on, and that they can see what the horizon is bringing, being proactive is really, it's just a little bit of an easier way to go. Here's some of the signs that you might need some support. Say you have a diagnosis of a chronic or a degenerative condition, and you notice that certain things are harder to do. Grocery shopping, there's a lot to, with grocery shopping. You gotta drive there, you gotta walk all the way through the grocery store, you're lifting, you're putting things in the cart, you're putting things on the belt, you're carrying things to your car, you're carrying them into your house, you're putting them away. Grocery shopping is a lot. And if that gets harder to do, start noticing that. Someone can help you with that. Meal preparation, getting your day started, getting out of bed, going to the bathroom and bathing and dressing, that can be exhausting. If that starts to be more than, a simple part of your day, then you might need a little bit of assistance. Okay. If you can no longer drive safely and legally, that may be a time to consider some care. If your balance becomes compromised, perhaps you've fallen once or maybe twice. If you're falling and you've not broken a bone, that's great, but you just don't know what the next fall will bring. So if you can bring in a caregiver, that might help you to prevent that next fall from happening. You know, if you find yourself asking your kids, your neighbors, your friends for help, whether it's for rides, going to the grocery store, helping you up when you've fallen, you're feeling like you're needing to depend on people, then, you know, it might be a lot nicer for you to hire someone to help you with those things. That way you don't feel beholden to people. You can do things on your terms. You know, when you're asking for someone to help you, you know, you have to go by when they're able to help you, you know, or if your child is, your adult child is working, they can only go to the grocery store for you after you know, their work day is done. If you hire a caregiver, you're in control of that. Okay. So once you've made that decision, I just want to talk to you a little bit about the process. Once you've made the decision to move forward, the first thing you need to decide is, you know, who's going to help me? Do I hire an agency? Do I go to a placement agency, see if they can find me a caregiver? Or, you know, do you know someone who knows someone who knows someone who had a caregiver who took care of their neighbor and they like them, so you got that person's phone number? That's the first thing that you need to do. So the process, you know, I'd like to talk a little bit about the process. I can't really speak to the process of hiring a direct hire caregiver or going through a placement agency, but what I can tell you is that if you use a licensed agency, there are built-in protections that come with that license. So if you want to consider going with a licensed agency, I just want to tell you a little bit about what that entails and how that can protect you. A home services agency have to follow rules. We follow the rules of the Illinois Department of Public Health. Those rules encompass hiring, insurance, and standards of care. Home services agencies employ their caregivers as full W-2 employees. That means we pay them, we take out their taxes, we vet them, we train them, and we supervise them. We also manage their schedule. Agency caregivers must document their activities, and they follow a care plan. And there's also workers' comp insurance and liability insurance to protect the client, the agency, as well as the caregiver. So to say it again, in short, there are rules, and rules protect people. So one last thing I want to add about home care. When people hesitate getting a caregiver, you'll see this right here on the slide. Seniors hesitate getting a caregiver when they need help, most often because they fear losing their independence. The absolute truth is, though, having a caregiver can help support you in your independence and help you stay in your home or wherever it is you most want to live. And with that, I'll turn it over to Sam to talk about senior communities.
Okay. So Charmaine did the should I stay part, and I'll do the or should I go part, which is if you're considering moving into a community. There are several things to think about when you're trying to decide which option is best for you. The big categories, and we'll kind of talk about each of these in a little bit more detail, but the big categories are the care and services that you need and what you're looking for, your current home and what is or is not working for you with your current home. Cost is another big category that comes into play. And social programs, how important that is to you, how easy is it for you to get to the social programs, to get to your medical appointments, and to be connected to a community. So I'll start with the types of care and services. So you think about what type of care and services will help you. And Charmaine talked about the personal care types of services. Around medications, one thing to keep in mind is we, like for our clients for home care, we can remind folks to take medications, but we cannot set up pills in the pill boxes. We cannot go to the pharmacy and get the medications for people. So there's a limit to what a home care agency can do. So if reminders is all somebody needs, that can work in with a home care agency. But if a little bit more is needed, then you need to consider some other options. Housekeeping and laundry services, and meals and transportation. These are all typically provided in senior communities as well. The extent or the frequency varies by the type of senior community. For example, with housekeeping, a lot of the independent living communities in this area will include housekeeping services once a month. Assisted living communities offer it every other week. And if you're in more of a healthcare setting, that housekeeping is typically done every single day. Same with meals. There's a little bit of a range in depending upon the type of community. In an independent living community, a lot of them will offer 2 meals a day, or you get like a meal balance at the beginning of every month. And it kind of works like a credit card or declining balance. Assisted living communities and healthcare centers offer 3 meals a day. Again, things to think about. Transportation is typically provided by senior communities, and it has a couple different layers to it. Usually there's scheduled transportation to like shopping trips that you would just sign up and go with a group on the bus. They also do offer transportation to specific appointments, but a lot of times there's a radius. So they'll go, 5 miles from the building or 10 miles from the building. So you have to think about how far away is your doctor, where do you need to go if you need assistance with the transportation services. So when you think about your home and what are the challenges with your current home, there's a few different things to think about with this. So the layout of your house is one of the big things. For a lot of people, the first thing that becomes difficult when you think about kind of moving throughout your home, if that's becoming challenging, is stairs can become difficult. And for a lot of us, myself included, I live in an old farmhouse that was built in 1941. So the bedrooms and the bathrooms with the showers are all upstairs. And the washing machine and the dryer are downstairs in the basement. So if stairs becomes challenging, it can be difficult to get to those parts of the house that you need to be able to get to on a daily basis. Some people have stairs to get in and out of their house, or you have stairs to step into your garage. So again, it can be tricky to navigate through. A lot of the houses that have been built more recently have open floor plans. So if you stand in the kitchen, you can kind of see the living room area, and you can it's like one big room. Older homes tend to have smaller rooms, which can become a little bit trickier to move from room to room if mobility becomes challenging. And the other thing to think about then is just how far is your bedroom to the bathroom that you use, or to the kitchen, or to the living room where you spend most of your time. And if getting from point A to point B is becoming challenging, are you able to get to the rooms of your home that you use every single day and do that safely, and feel secure about that? Accessibility, that really talks about, if somebody is using a walker or a wheelchair, the doorways need to be wide enough in order to be able to safely go through. In some of the older homes, those doorways are not wide enough. We have folks where they can navigate through parts of their house, but there are certain rooms that they can't get to because the doorways aren't wide enough to accommodate their walker or their wheelchair. So again, these are just some things to think about. There are modifications that can be done to your home so that you can continue to stay there and, to access those parts of your house. There are lifts that can be put on staircases, so you can kind of get on a chair and ride up the stairs so you can get to that upper level if doing stairs becomes a challenge. Walk-in showers can be installed. So if you have a traditional bathtub and it's becoming a safety hazard or challenging to step into that bathtub to take a shower, you can have the tub taken out and a walk-in shower put in that can accommodate a shower chair and all of those types of things. And ramps are something that can be pretty easily installed as well. The thing to consider, though, is depending on what type of equipment or modification you might need, there's a range in the costs. So, how much does it make sense to spend on these home modifications? The maintenance of your house is another thing to consider. I mentioned I live in an older home, so we have big repairs that come up every so often. So if the roof needs to be repaired, or the windows, or you've got seepage in the basement, if you have big repairs like that to need to be done, does that make sense to put that money in to do that? And then just the general maintenance, if it's becoming challenging, maintaining, the lawn and the snow removal, keeping your appliances up to date. If it's becoming hard to stay on top of all of those things, it can be an indicator that moving to a senior community might be a good option for you. And location, of course, is something to consider as well. Most of us kind of get into that routine of where we go. We have our favorite grocery store, we go to our doctor's appointments, the pharmacy, we go to, the senior center or the YMCA, and we have this little pattern, geographic area that we travel in. So, is your house conveniently located to those places? Is it easy for you to get to them? Is your family close by and in the area? And is that something that is important to you? And then, of course, finances. Cost, is a factor in every single decision that we make. So there are some things to think about. The cost of home care, bringing services into your home versus the cost of moving to a senior community. And really, depending on how many hours of caregiving services you're considering and the type of senior community you're considering to moving into, there is a sort of a breaking point where it can actually be cheaper to move into a senior community. In our area, assisted living communities tend to start around $6,000 a month for the rent piece of things. And then in addition to that, there are levels of care, and those tend to range from about $500 to $1,500 a month. So that's on top of your rent. Memory support communities are structured a little bit differently. The care is included with the rent, so you have one cost instead of adding the two things together. And in this area, memory support communities tend to start about $8,500 a month. Sounds like a lot of money, and it is. When you think about caregivers, if you go through a licensed agency, and again, kind of in our geographical area, it tends to cost between $35 and $40 an hour to have a caregiver come in. So if you just, you just strictly do the math, again, there is a tipping point depending on how many hours of caregiving services you're considering bringing into your home. It may be cheaper to move into a community. The other thing to consider if you are looking at staying in your home is you have all these ancillary costs that are just kind of reoccurring. So we tend to forget about them, but your property taxes, your homeowner's insurance, the ongoing maintenance and repairs, lawn and snow removal services, your utilities, if you have like association fees or a rent or a mortgage, those all are included in the cost of staying home. So if when you're doing your calculations, they need to be factored into that. There are some products or programs that can help offset the cost of both home care and moving into senior communities. Long-term care insurance plans, not everybody has those. We would say maybe 50% or so of our clients have long-term care insurance plans, and each policy is different. If you do have a long-term care insurance plan, check the plan. A lot of them have coverage for licensed assisted living communities, licensed skilled centers or healthcare communities, or the nursing home, kind of the older term, and licensed home care agencies. Long-term care insurance plans are not going to cover the whole cost of any of those options, but they help to offset the cost. So they do help your money to stretch or last a little bit longer. The VA also has a benefit called the aid and attendance benefit, and that is available to veterans and widows of veterans. There are criteria that have to be met in terms of when you were in the military and if it was during a period of active wartime. And then there are financial criteria that need to be met as well. So based upon that, there is a monthly stipend that can be used towards assisted living, skilled nursing, or home care services through a licensed agency. And there's an application through the VA for that. We have also seen some Medicare Advantage plans are starting to offer home care services. As a country, that benefit tends to be offered more on the East and the West Coast, but it is starting to come to the Midwest a little bit more, and there are conversations that that benefit will start to see more and more of that. So again, that's for a licensed home care agency. And when you're looking at senior communities, a lot of them are private pay, so you're going to, pay out of your own pocket. Some do offer a sliding scale with the monthly rent. So depending upon what your income is, the rent will be adjusted accordingly. There are affordable housing options in the area as well. And then there's something in Illinois called a supportive living facility, which is like an assisted living community, so provides the same type of care as assisted living, but it does offer a financial aid component to it. So it's part of the Medicaid program. The next thing to think about really is socialization. And this is a very individualized thing. So, you have to think about how important is it to you to be able to attend group programs and participate in that. And if that's something that is important to you and you're doing that now, is it easy for you to get there, or is it becoming a little bit of a challenge? If it is becoming a challenge, you can have a home care caregiver who drives, who can take you to the programs that you want to be able to get to and to appointments. One of the big benefits of moving into a community is that there is a lot going on. So if you are somebody who is social and likes to be involved in things, there's options literally outside of your apartment door or your home at the senior community. So it's very convenient to get to those types of programs. A lot of senior communities also have physicians who visit there, and they have like a beauty shop on campus, and a day where like the podiatrist will come, the dentist will come. So there's a lot of convenience that's built into things. So those services come to you versus you having to figure out the logistics of getting to them. And with friend and family support, again, this is something that is pretty individualized, but how available are your friends and family to help you? And how much do you want to rely on folks? Bringing a caregiver into your house can help alleviate some of that. Moving to a senior community can also help alleviate some of that too. And we do see a lot of times where, kids grow up, they move away, or even if they're close by, they're raising their own families. So they don't necessarily have the time to come over and provide that help and support. So there are other options out there to be able to help you. I thought it might be helpful too to talk about the different types of senior communities that are out there, because as you think through all of those things, what type of care do I need? What are the challenges to my house? What does the financial situation look like? How important is the social aspect? That can help you drill that down then to what type of a community might be the best fit for you. We're very fortunate in this area that, this geographic area, that there are lots of choices. The downside of that, though, is that it can make things a little bit confusing. So when you think about the levels of service, those are the different types of communities. And you may have heard of like a 55 and up active community. That's basically like an apartment building for people who are 55 and older. There aren't any services that come with that. So you're responsible for your own housekeeping, your own laundry. Sometimes they'll do like a continental breakfast on Sunday, or they'll put a little grab and go thing out there, but you're pretty much on your own. It's just a building of folks who are 55 and older. Independent living is very much what it sounds like. It's similar to that 55 and up, but there are more services that are included. So that's where housekeeping is typically like once a month. They'll have dining rooms in the community where maybe 2 meals a day come included, and you're responsible for preparing the third meal of the day. So the apartments in independent living have full kitchens in them most of the time. Assisted living is sort of the next option in that continuum of care. So with assisted living, in addition to that housekeeping services and the meals, there's 3 meals a day included with assisted living. And then there are options for personal care. And usually what happens is a nurse would meet with you before you move in and do like an assessment. And that assessment would determine which specific level of care is going to provide the type of support that's right for you. And that's where you have that rent plus care as your total monthly cost for assisted living. And then healthcare and skilled nursing, that is really the highest level of care that you can have outside of a hospital setting. So there you're going to have nurses, they're 24 hours a day, 7 days a week, more caregiving staff. And so there's more care that can be provided in that setting. And some skilled settings have folks who live there on a long-term basis. And then they also have folks who maybe go short-term for rehab, and that's covered like under your Medicare or your health insurance benefit. With the financial structure, the two biggest things to choose from is they have what they call an entry fee model or a rental model. And this is when you're looking at independent living as an option. And in an entrance fee model, you're going to put down a very large deposit. Typically, it's in the 6 figures. And then in addition to that, you pay what's called a monthly service fee, or like what is your monthly rent. When you leave that community, a portion of that entrance fee, that large deposit, is refunded to your estate. And the specific percentage depends upon the type of a contract that you choose to sign. In a rental type of a model, there's no large deposit like that. You pay the monthly rent. In general, in a rental community, the monthly rent is going to be higher than the monthly service fee of the entrance fee model, because you haven't put down that large 6-figure deposit. And then freestanding versus continuum of care. Freestanding communities will offer 1 level of service or level of care, sometimes 2. So like you'd have an independent living building, and that's what's in that building. There's no assisted living, there's nothing else. There are a few communities in the area that offer assisted living and memory support. So they have 2 options. That still falls under that freestanding kind of a definition. Whereas a continuum of care offers the whole range. So you'll have independent living, assisted living, memory support, skilled nursing, short-term rehab, all on the same campus. So depending on what you're looking for and what feels more comfortable to you, some people like the continuum of care structure because they know that should things change over the course of time, there's all these different levels of care that are available for them. And you just very smoothly move from one to the next. And you have that guarantee that that care is there. So I feel like we threw a lot of information at you about home care options versus things to consider when you're looking to move to a senior community. It is a lot, and it's a very individual choice. There, sometimes it can make sense to stay at home and bring care in for a certain period of time, and then something changes, and then it makes more sense to move. So it's kind of a fluid process as well. Really, ultimately, you choose the road that is best for you. And I guess at this time, we can open it up to any questions that people might have.
I have the phone number of the Always Best Care.
Sure. Are you ready?
I'm ready.
Okay. Our office number is 847
Yeah.
730
730.
5930.
730-5930.
Correct.
Thank you.
You're welcome.
Any other questions from the group? All right, if you do have any questions, Sam did give out their phone number, and I also have their emails and phone numbers as well, and you can check them out online. With that, we're going to close out this session. Thank you again to everyone for speaking today, Charmaine, Sam, and we look forward to having you speak to us again.
Thank you.
With that, that concludes our YES Education Series presentation. On behalf of the North Suburban YMCA, we thank you for attending today. Our next talk is Wednesday, October 12th. It's our Medicare review session. That'll be at noon. So we look forward to seeing you there at one of our future talks. Thank you again to always, thank you again for the talk today, and to Always Best Care, and we'll see you all soon.
Thanks, Pam.
Thank you.
Thank you so much. Thank you, everybody.
Thanks, everyone.